Occupational English test. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning, I'm Dr. Marcus. How are you feeling today?
Hi, Dr. Marcus. I'm not feeling great. My leg hurts a lot.
I see. Can you please tell me your name?
My name is Kieran Llewellyn.
Thank you, Kieran. And how old are you?
I'm 35 years old.
Great. Can you tell me your address and the type of residence you live in?
Yes, I live at 8 George Street in Sydney. It's an apartment building in an urban area.
Thank you. Who are your closest relatives and what do they do?
My husband's name is Aaron Llewellyn. He's a software engineer. My mother is Elizabeth Thompson, and she's a retired teacher.
Thank you for that information. Can you please tell me why you came to the hospital?
I fell down the stairs in my apartment building while carrying a heavy box, and I think I fractured my right leg.
I see. Do you have any past medical history that I should be aware of?
Yes, I have asthma and seasonal allergies, for which I use an inhaler and antihistamines, respectively. I also had surgery for appendicitis a few years ago.
Okay, thank you for letting me know. Does anyone in your family have a history of illness that I should be aware of?
My mother has a history of hypertension, and my paternal grandfather had a heart attack in his 60s.
Thank you for that information. Can you tell me about your social history and employment?
Sure, I'm married and work as a managing executive in a multinational firm. I lead a sedentary lifestyle and don't engage in any physical activity regularly. I drink occasionally and smoke a pack of cigarettes a day.
Thank you for sharing that with me. Do you use any recreational drugs?
No, I don't.
Thank you. Can you tell me about your dietary habits?
I try to follow a balanced diet and avoid foods that trigger my allergies.
Okay, thank you for all that information. Can you please tell me the names of any medications you were using before coming to the hospital and their dosages?
Yes, I use a salbutamol inhaler 100 micrograms, 2 puffs twice daily for my asthma, and loratadine 10 milligrams, 1 tablet daily for my allergies.
Thank you. Now, I need to take some vital signs. I will measure your blood pressure, heart rate, respiratory rate, temperature, and oxygen saturation. Your blood pressure is 120 over 80 millimeters of mercury, your heart rate is 85 BPM, your respiratory rate is 18 breaths per minute, your temperature is 98.6 degrees Fahrenheit, and your oxygen saturation is 96% on room air. Based on my assessment, I believe you have a right tibial fracture. We will need to perform an X-ray to confirm the diagnosis.
Okay, I understand.
After the X-ray confirms the diagnosis, we will immobilize your leg with a cast for 6 weeks. I will also prescribe pain relief medication and prophylaxis for deep vein thrombosis. If needed, you will be also given paracetamol 1g, 1 tablet every 6 hours, and enoxaparin 40 mg, subcutaneous injection once daily. You will need to keep your leg elevated and avoid putting weight on it. We will also provide nursing management during your stay in the hospital.
Okay, thank.
After your stay in the hospital, we will provide you with a discharge plan, which will include a referral to an orthopedic specialist for follow-up care. You will also need to continue taking pain relief medication and prophylaxis for deep vein thrombosis at home. You will need to come back to the hospital for follow-up x-rays to monitor the healing of your fracture.
Okay, I understand. Thank you, Dr. Marcus.
You're welcome, Kirin. If you have any questions or concerns, please don't hesitate to ask. We are here to help you.
Thank you, Dr. Marcus.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning, I'm Dr. Adam, and I'll be taking care of you today. Can you please tell me your name?
Hi, my name is Aglaya Andrescu.
Thank you, Aglaya. Can you tell me your age?
I'm 29 years old.
Great. And what's your address?
I live at 23 High Street in Dublin, Ireland.
And what type of residence is that?
It's an apartment in an urban area.
Okay. Do you have any family members or close relatives living with you?
No, I live alone.
All right. Do you have any close relatives who we can contact in case of an emergency?
Yes, my mother and father live nearby. My mother works as a nurse in a hospital, and my father is a chef in a restaurant.
Thank you for that information. Can you tell me why you're here today?
I've been having joint pain, swelling, and stiffness in my knees and ankles for about a week now. I also have a fever and feel fatigued.
Okay, I see. Have you had any similar symptoms in the past?
No, I've never experienced anything like this before.
Do you have any medical conditions or past surgeries that we should know about?
No, I'm generally healthy.
Does anyone in your family have a history of arthritis or autoimmune diseases?
Not that I know of.
All right. Let's talk about your social history. Are you currently employed?
No, I lost my job as a bartender due to the pandemic.
I'm sorry to hear that. Do you smoke or use recreational drugs?
No, I don't smoke or use drugs.
Do you have any allergies?
No, I'm not allergic to anything.
Okay. Can you tell me about your dietary habits?
I try to eat a balanced diet and don't have any dietary restrictions.
Thank you for that information. Are you currently taking any medications?
No, I'm not taking any medications.
All right. Let's take some vital signs and do a physical exam. Your vital signs are blood pressure, 120 over 80 millimeters of mercury, heart rate, 80 beats per minute, respiratory rate, 16 breaths per minute, temperature, 38.5 degrees Celsius. On physical examination, you had tender and swollen joints in both knees and ankles. Your other joints were normal. You have a low-grade fever. Based on your symptoms and physical exam, I suspect that you have reactive arthritis. We'll need to do some blood tests for C-reactive protein, complete blood count, rheumatoid factor, and anti-nuclear antibody, a joint fluid analysis for inflammation and evidences of infection, and imaging tests like X-rays of the affected joints and imaging studies to confirm the diagnosis and rule out other possible causes.
Sorry, I didn't get you. What kind of tests do I need to undergo?
We'll need to do some blood tests to check for markers of inflammation, as well as a joint fluid analysis and imaging studies such as X-rays. In the meantime, we'll provide you with a short course of nonsteroidal anti-inflammatory drugs to help relieve your joint pain and inflammation, and we will immobilize your affected joints with splints.
Okay, thank you, doctor.
You're welcome. If the diagnosis is confirmed, we'll refer you to a rheumatologist for further evaluation and management. Your discharge plan will include continuing your pain relief medication and avoiding weight-bearing activities on your affected joints. Make sure to follow up with your primary care physician as needed.
I understand. Thank you so much for your help, doctor.
It's my pleasure, Aglaya. I hope you feel better soon.
Thank you, doctor. How long will I need to stay in the hospital?
We'll need to keep you here for a few days to complete the necessary tests and manage your pain. Once we have a better understanding of your condition, we'll discuss your discharge plan with you.
Okay, that makes sense. Is there anything else I need to know?
Yes, I want to stress the importance of continuing your medication and following the instructions we give you for taking care of your joints. It's also important that you rest and avoid any activities that may aggravate your symptoms.
Understood. Thank you for your care and guidance, doctor.
You're welcome, Aglaya. We're here to help you through this. If you have any questions or concerns, please don't hesitate to ask.